Hello and welcome to the Ophthalmologist Live Resident Roundtable. I'm Phoebe Harkin, Deputy Editor of the Ophthalmologist, and I'm joined by a wonderful panel of residents. Let me introduce you to Iman Tarib from Morocco, Atanas Bogoev from Bulgaria, Henal Javeri from India, Enesu Madikane from South Africa, Valentina Gracia Ray from Colombia, and Reza Muradi from the United States. Just to mention that Iman will be acting as moderator for this discussion. And as a reminder, our panelists will be happy to answer any questions you might have at the end of the webinar. You can submit questions at any time by clicking the questions button. Okay, let's get started. Iman, I'll pass it over to you.
Thank you very much, Phoebe. I would like to thank the ophthalmologists for giving us this wonderful platform to share something that we are all going through. For everyone who missed Dr. Atanas Bogoev from Bulgaria, you can see him now on the screen. I would like to thank all of the residents who joined us today, Dr. Anisu, Dr. Reza, Dr. Henal, Dr. Valentina, and Dr. Atanas. Thank you so much for coming here and to share your experience with the world. Thank you for all the attendees. And our subject today is to talk about how everyone has been affected by this COVID-19 when it comes to their training as ophthalmology residents. And my first question to all of you guys is, how has your country been affected by this pandemic of the coronavirus? And where are you right now in terms of the disease curve? So I would start with Dr. Anisu.
Hello, everyone. So I'm representing sunny South Africa, and like the rest of the world, we have been affected very dramatically by the COVID-19 pandemic. As far as Africa is concerned, especially Southern Africa, we have the highest number of recorded positive cases. Currently, we're standing at just under 100,000 positive cases, with our death rates just below 2,000 cases. So as per academic predictions, we're currently just about to enter our peak. We've been on lockdown, full lockdown, since the 27th of March. So that's about 3 months now. Initially, it was a full lockdown with people not allowed to leave their homes, go anywhere except for work. But slowly, we've been phasing into lower and lower phases of the lockdown. Currently, people are going to shopping centers with mandatory use of face masks and going to their workplaces, but things are very slow. Specifically with regards to the effect on the healthcare system, we have seen a dramatic decline in the number of routine clinic appointments. So as far as ophthalmology is concerned, that has really affected our exposure as residents to a diverse group of diseases. And also surgically, there's been a huge impact with almost total cessation of all elective surgeries since the 27th of March. So as you can imagine, the impact has been dramatic for me, especially as a or for all of us who are trainee surgeons and trainee ophthalmologists. So that's it from South Africa.
Thank you, Anisu. I really hope everyone will be safe and healthy very soon. I suppose you've all been through the peak of the curve to a certain extent, and this varies from a country to the other, but really happy to see things getting better slowly. How is it where you are, Reza?
So I'm Reza Muradi, and I'm representing California and the United States here. So the COVID-19 peaked here started in March, and we've been on lockdown, especially for ophthalmology, since March 18. At that date, AAO recommended to stop all the elective surgeries immediately and just pay attention to urgent and emergent ophthalmic cases. Regarding the society, we are going through phases in California, so things are opening up slowly. Right now, people can go to restaurant and eat outside if they have a patio, or some of the bars are serving drinks in the street. It's like Vegas now. People can drink in the streets. In the past, it wasn't possible, but situation has been changing, but very slowly. Some businesses are opening up. In the hospital, most of the clinics are back in business, but we are seeing maybe between 30 to 50% of their normal volume, because you have to practice the physical distancing and just avoid patients waiting in the waiting area, and you don't want to have a crowded waiting area that you used to see in the past. So we have to kind of prioritize our patients, prioritize the patient with severe diabetic retinopathy or glaucoma first, and then we pay attention to patients with less severe or or vision threatening conditions. So regarding the elective surgeries, most centers or almost every center, they stopped doing elective surgeries on March 18. But regarding the opening phase, it has been different, depends on the policy of each center. The center that I'm working, which is a county hospital, we stopped all the elective surgeries till June 15, and we are resuming surgeries since then, but very slowly. In the past, we used to have 1.5 day full OR block, but now we are just doing one elective case per week for in this phase, which is going to be phase 1, and then eventually we're going to ramp up. Some other centers, they are back to their 80% or 100%, depends on the policy and the equipment they have. The limiting factor is that the pre-op area and also testing capacity of the hospital. All the patient has to do testing within 3 to 5 days prior to their surgeries, and then self-quarantine themselves before the surgery. So we are hopeful situation because we flattened the curve, and if we don't see any another peak in summer or fall, hopefully situation will remain the same, and eventually we're going to be able to provide more care to our patients. But as Anisud mentioned, so it's not a good time to be in training. Our numbers has been affected. We lost a lot of cases, and hopefully we can catch up in the future, either during residency or fellowship.
Yes, exactly. This is exactly why we're here to share with each other, so we can all come probably and hopefully with some great solutions to make it up for all the lost time in this pandemic. So how is it now? It is really refreshing to hear you saying that people are going outside, Reza. So I'm really happy for you guys to be able to do this now. So moving on to Hinal from India. As a young resident in India, Hinal, how do you feel your country and your training has been affected personally?
So firstly, I'd like to say hello and namaste from India. So, and I'd really like to mention a shout out to the Ophthalmologist magazine and Imane for doing this and providing us with a wonderful opportunity to connect. As far as India goes, I'll just give you a brief overview. As it's very known, we have a very large population of 1.38 billion people, and in our country, up till now, we've had about a little over than 400,000 cases, but half of them have recovered at this point. There have been about 14,000 deaths, but we have been able to, slow down the progression. And while the country was in lockdown from March last week, we have starting from June 3rd, we've been able to, gradually lift up the lockdown and start work. And I think it's a very similar situation everywhere regarding the healthcare scenario, where all emergency and only emergency procedures were the ones that were taken up, and all non-emergency, non-urgent procedures were postponed. And very recently, that is from the first week of June, have we started taking up elective procedures. So that's the current scenario in India as well.
Well, it's again great to hear that things are getting better. So I feel like almost everywhere things are going back to normal gradually. Definitely the speed of that depends on the country, but it's always refreshing to hear it. Now, all the way from India to Colombia, I would like to ask Valentina, how is it in Colombia, Valentina?
Sorry, can you hear me now? Yes. Okay, so I think I speak for Colombia and maybe most Latin America. I think it is interesting how the pandemic has moved, like from Asia to Europe, and now it is like the hotspot is here in America, also in USA, like Reza said, and here in Latin America. So here we are like peaking every day. We have more and more cases. At the start, in the middle of March, we had a lockdown, a total lockdown that happened like overnight, and we stopped going to the clinics, and we only went there once every week to see urgent patients. Right now, we're kind of opening a little bit more, seeing more programmed patients for consults, but the government is very mean in the need to only operate urgent cases. Nothing like programmed cases, cataract cases, and all of this. Only like trauma and really, really urgent cases. We just yesterday had 100 days of lockdown. So we have been on lockdown on a long time. At the start, people were like very strict, adapting these new social distancing measures. But right now, people are like getting bored, and they are starting to come out every day a little bit more. Every day, some industries open up a little bit more, and that has given us like the time to get a kind of a steady rise, but in a slow rate. It has affected our healthcare system a lot, because our healthcare system is like a mixture of private and public health. So everyone is affiliated to the healthcare system, but the clinics are the ones that, private clinics are the ones that provide this service. So they have had to make a lot of investments in personal protection measurements, and in they had to lower down a lot their patient vacancy. So it has really affected us. And specifically speaking of Barranquilla, that's where I'm based at. Here is the city of Colombia that has the most cases. So we're very scared here, and people just, I know that it's not that they're not aware of the problem, but since we are our country going on development, people with poverty and people with some problems really have to go out, because if they don't do this, they maybe not get money for their food. So I think that's it for Colombia. I think I gave like a very general panorama.
Yeah, thank you for that, Valentina. Thank you for giving us an idea of how it is. I suppose it must be really confusing to go through this, knowing that you are in the hotspot of the country. But I am sure with the right tools, and I know how you are surrounded with some great people in ophthalmology, so I am sure you'll get out of it pretty well. And now moving on to Dr. Atanas from Bulgaria. How is it where you are, Dr. Atanas?
Hello. I'd like to thank Iman and the ophthalmologist for the invite. It's a great opportunity to participate with you in this discussion. So in Bulgaria, to give you some context, I can see a pattern here with all the speakers, but the interesting thing in Bulgaria is that when the pandemic actually began to hit Europe, especially Italy, we started with very strict measures with total lockdown for 1 month. And then the government gradually extended this period. Then in April, we started gradually open up our practices and doing surgeries that were non-emergency. And then we started opening up our economy, started to open up small businesses, and then we started opening malls, and people started to gather more and more. And recently, interestingly enough, in the last 2 weeks, people were allowed to go outside without wearing masks. And we actually saw an increase in numbers. So during our peak, there were 80 or like 90 people per day that were diagnosed with COVID. And now we're seeing in the hundreds every day. So this is a little bit alarming. And the government are discussing to basically put measures for social distancing and wearing masks outside to make that mandatory. But they actually said in front of the public they do not plan to shut down the economy once again. So this is quite interesting, and we're looking forward to what is yet to come.
Yeah, thank you, Atanas. This is a great reminder that even though things are getting better, does not mean that the social distancing measures have to stop. I saw a funny meme recently that said, if the weather is good, it doesn't mean the coronavirus is gone. So definitely a wonderful reminder how we should always keep those social distancing, at least for the moment being, and wearing the masks is tremendously important. Now to the core of our subject, thank you guys for sharing how things are in your countries. I'm loving how we have perspective from Africa and America and Asia, Latin America and Europe. This is wonderful. And Dr. Hinal, you're a third-year resident, and I wanted to ask you if you felt or thought that there was a particular role that young ophthalmologists had to play during this crisis.
So, I feel that young ophthalmologists are really important in this scenario because we can be in the front line. We can act as shields for our senior consultants who are at a much higher risk due to their age of contracting the virus. So, in this sense, we really are important. And this entire scenario also provides us with an added benefit of being able to see a patient, assess their condition, and come up with a plan of action for managing the condition all on our own, providing us with independence and also leaving us with confidence at the end of it. And we always have our mentors and seniors to help us, that is, they are rather more free at this point to help us out. So in that sense, this scenario works out well for a young ophthalmologist in training.
Yeah, definitely. That's a great way to look at it. You guys were taking the lead, being in the front line instead of your seniors who were actually having a risk factor just from being in a certain age range. And that is quite interesting to look at it this way. I'm glad you guys also had the opportunity to learn more and be faced by more challenging situations, and the mentorship that you were having virtually must have definitely helped as well. Now, Dr. Atanas, I know you have a great big community of young ophthalmologists that's very well networked in Bulgaria. Did you feel like they had a particular role during this crisis?
Oh yeah, definitely. Just to say, I work in a private hospital, and the way this whole situation affected me and the residents at the private hospital, you could summarize it basically in one word. It was uncertainty. So first of all, our work schedule was very uncertain. First of all, we started working only in emergency teams. We did rotations every 2 weeks. Basically, we didn't know what was coming. So this was one thing. On the other side, the education in Bulgaria, the residents during their 4th year of residency, they have to take 2 mandatory courses that are in the university that last 1 month. So I personally had to take this course during this time, and it actually got canceled completely. And regarding training, practical and surgical training, so we saw very few cases of planned surgeries. So that meant less assisting in surgery and less participation in surgery steps and surgical training.
But I believe young ophthalmologists as well must have taken into their hands a lot of steps during the clinics that were still taking place, as most of the youngest, as we know, take the emergency calls most of the time. At least that was the case where I am. And I suppose, yeah, it is everywhere. Interesting. And so did you guys feel like this COVID crisis had an impact on the use of all the virtual platforms that we're using, such as social media, in maybe dealing with it in a better way? Valentina, do you have any take on this?
Yes, of course. So this time started like Atana said, with a lot of uncertainty. Uncertainty was everywhere. I'm a 2nd year resident going into 3rd, like in just a few days. So I'm very kind of excited for on one side, but also with a little bit of maybe a little bit of loss of hope, because in the 3rd year is the time where we start going in our PACO steps, and I don't know where will that start. That being said, I think social media has had a very positive impact in the pandemic. So social media, I was very reluctant to the massive use of social media at the beginning. At the beginning, there were a lot of webinars. Every day there were more webinars. You could spend a whole 24 hours a day watching webinars of ophthalmology all around the world. So at the start, I was very I would say amused, but at the time scared, because I thought like maybe human contact was being lost. But I understand with time that is not that human contact is being lost. It is a new form of contact. I would say maybe not personal contact, but it has definitely shined a spotlight in different ways we can connect with other people. And it has given me the opportunity to connect with people all around the world, not just the people here in Colombia or maybe near cities near where I live. Like I can connect with all of you now. I have like friends all over the world, and I would say that really makes me happy. So I was really inspired by this, and I started like searching for these spaces where I could like make my voice heard in other places. So I recently started doing some lectures for general practitioners here in Colombia, so they can learn a little bit about ophthalmology. I think I have maybe gotten a good use of my time during this during this pandemic, and I think I'm trying to make the most that I can, like to make all the doctors like know a little bit of ophthalmology, because I know here in Colombia, when you're in medicine school, you don't have that much training in ophthalmology. Like you just know that there are two eyes and that's it. So I have tried to maybe let them know that there's a lot of other things that you can do with eyes, maybe without specifically speaking like a slit lamp, because I know it's difficult to manage it, but maybe you can just shine a light on the patient's eye and maybe know if there is something really wrong going on. And I have tried to maybe go on that path. That has inspired me too. Specifically, Imane has really inspired me. I recently opened up an Instagram page trying to network with other resident ophthalmologists, and I'm really excited. I'm slowly growing, but I'm really excited about it.
That's really great, Valentina. And I've seen you doing a glaucoma talk to general doctors, and I was really impressed by this idea because you were impacting patients indirectly by letting maybe general practitioners know about certain emergency signs that would maybe help somebody's sight someday. So that's really wonderful. What about the use of telemedicine in treating patients? Do you have any take on this, Reza?
Yeah, that's a very good point. But can I add a comment to your previous question?
Sure.
Because I'm representing California, United States, and also Iran, so I want to just have a shout out to my colleagues in New York who has been pulled to cover ICU and help out patients who need care. So it seems that in some states like New York City or some countries like Iran or Italy, there was only one team, which was medicine team, regarding what was their subspecialty, and everyone was trying to just participate in this battle and just help the patient in the ICU, regardless if you're a cardiologist or ophthalmologist or an OBGYN specialist. So fortunately in California, the surge in our hospitals was not that bad, so we didn't have that issue. But a lot of my colleagues who were ophthalmology residents, they've been pulled to help patients in the ICU in New York, and that definitely affected their training. That was one of the reasons that here in the United States we postponed or made the OCAP, which is an annual examination that we have as a resident, and made it as an optional, because it wasn't fair to take the exam while we are not working the ICU and my colleague is working in the ICU. So that was something that I want to add on. Regarding the telemedicine, that was, I think, one of the benefits of this crisis in our field. So while a lot of traditional old school attending never used social media or tried online videos, so now they are very pro in using Zoom and delivering lectures, and they're open with this idea of using this technology in practice. In our clinic, starting shut down, so we switch almost all the visits to a telephone visit. So we call our patient, talk to them over the phone, and ask them how they are doing, like a regular interview that you have. It was just a phone call, and we figure out if they need any refill on their medication. We make sure that they don't run out of medication and forget about taking care of their eye pressure. And if any of their symptoms were concerning, like if they say that, okay, I have some discharge from my eye, or you feel that this is something concerning for a patient with a PDR about retinal detachment or anything like that, we ask them to come over. So we didn't cancel any visit. We just switched them to a telemedicine. So that was a great addition. I know in some practices, especially oculoplastics, they are using video calls. So patients are kind of, because everything is out, you don't need a slit lamp for oculoplastic for the majority of the time. So you can just, if you have a good quality video call, you can just examine the patient online. So that's one of the things that is now very popular, and they're building up a secure platform to just chat with their patients and examine them over the phone and provide some recommendation. If they need any intervention, they definitely arrange for an in-person visit. Unfortunately, some fields like for glaucoma, although there are some tools that patients can check their IOP at home, or in some facilities they can take some fundus camera pictures and send it to their ophthalmologist, but it's not widely available to everyone. So maybe that could be the next step, that if they can check their pressure accurately, or they can provide a good quality image of the fundus, so doctors can just weigh on that finding through telemedicine. But I think that's the start of our journey to exploring telemedicine and ophthalmology more. And hopefully in the next few years, we're going to see the effect of this kind of change.
Yeah, for sure, Reza. This definitely was a good push for redirecting probably everyone in medicine towards at least being more curious about telemedicine. And I am sure there will be one or more things that we can do through great tools like that in the future. This is really great that we could find ways to still be in touch with our patients and impact them and help them. I personally have been receiving so many calls from patients, maybe, as you said, glaucoma patients asking, well, there's a pandemic now, do I have to stop my medication? And I have to explain how it has nothing to do with the glaucoma medication, the fact that there is a pandemic. So yes, definitely a lot of things have to be developed in the future for us to be using it fully. But I am sure, even though we are trying to do a lot of things virtually, some things still cannot be adequately replaced, such as maybe some trainings or some connections with patients, etc. Anesu, do you have anything in particular that would not be adequately replaced by the virtual?
So similar experience to everybody else. I have enjoyed the fact that we have a lot more access to webinars. However, what has really been impacted dramatically is surgical training. And I think all of us can agree that there is nothing that beats hands-on, side-by-side in-theater surgical training. You can watch 100 videos of the best surgeons in the world, but unless you're actually getting an opportunity to cut yourself with a mentor seated beside you, guiding you, you're not going to learn how to do it. You know, you need to do a certain number of cases to gain that surgical proficiency that will qualify you to be an excellent surgeon. So that is something that has really taken a knock with the advent of this pandemic. I am a final year registrar, so I am nearing the end of my training. And usually towards the end of your training, the focus is on refining skills, because you've got all the basics, you know how to phaco, and now it's about perfecting. So I think that that's quite an important phase of our training, which specifically for me has taken a knock this year. Currently, I've lost about 6 months of surgical time. I've continued to do emergency cases here and there with a bit of motivation, have been able to book a glaucoma drainage device on a slate or a trabeculectomy. If it is an emergency like a phacomorphic cataract, have been able to do a cataract, but haven't been doing the volume that I'm used to. So I am a bit anxious about the time that I've lost. But also what this year has taught me and what the pandemic has taught me is that we emphasize time so much, and oftentimes things that we think are urgent are not as urgent as what we think they are. So I'm still very optimistic. I'm grateful for the lessons that I've learned during the pandemic, and I'm sure I'll have more than enough time. I mean, I have a lifetime as an ophthalmologist, so I'll have enough time to make up the surgical cases.
There you go. I love this spirit. I can totally relate on the fact that towards the end of your residency, you really want to make the best out of the time left to enhance those surgical skills and maybe learn some new. This is, of course, I suppose, something that's common everywhere. The most of the ophthalmologic surgeries are elective, and so we had to stop that for a while. So this is when it comes to training. Now, what about what you cannot really replace when it comes to doctor-patient relationship? What about that, Henal?
Yeah, that's what I feel that, you know, there's only a certain amount of connection that you're going to be able to build with a patient behind a face mask and personal protective equipment. When what you know, as a doctor, what you really want to do is comfort the patient before even beginning the examination. And, you know, probably, you know, you'll pat the patient on the back or something. There's always that personal connection which cannot be replaced by a virtual medium. So that is something that will, you know, that is something which is a downside in a way, especially for pediatric patients who are so apprehensive before an examination. And, you know, it's difficult to get them to sit in one place and let you examine, especially with an IDO, where they are so afraid of, you know, what you're getting in front of them. So in that sense, I feel this will take some getting used to. But as Valentina said, this is just a different form of communication, a different form of doctor-patient relationship, and it is something that we are going to have to build on. So I'm still hopeful that we'll get used to it and we'll form our own connection in a way.
Yes, definitely, as you should. And I am sure we'll find better ways to show the empathy and compassion that we have for our patients. As you said, in certain parts of the world, like where I am from in Morocco, it's very important to touch people and to hug and to, you know, shake hands. So I suppose we're going to have to come up with new ways to show that affection and compassion. Now, Valentina, you brought up the surge of great educational content and all the webinars and all these educational presentations that we all have now access to free of charge. Things that used to be maybe exclusive to certain meetings are now out in the open for all of us to use. And I particularly always see Atanas in the chat boxes of certain webinars that we have some common interest in anterior segments, so we usually meet up in webinars. What do you think are the benefits of this now and in the future, Atanas, for education in ophthalmology?
Wow. So, I mean, those webinars that we see now, we see the positive side of this lockdown. So you have all the world mentors that actually now have the time and the ability to share their skills with the world. And we as residents and young ophthalmologists, we get that for free. So we should definitely take advantage of this. And I know, as Ernesto mentioned, you cannot beat practical skills and you cannot beat real surgical training. But what we can do right now is focus on learning the theoretical part, trying to find those tips and tricks that you know, those busy people will not be able to share with us other than going to conferences that are maybe extremely big, and maybe we see them for a very limited time. And now we have the opportunity to see them daily from our house. So that's amazing.
Yes, definitely. And I heard that you held a very big web meeting in Bulgaria for young ophthalmologists there. Was the experience as enjoyable as attending one?
Yeah, so as I mentioned before, the residency course that was mandatory actually got canceled. So what I did with one of the professors is I actually made a plan and gathered all the residents, and so we actually scaled up this course and made it bigger and bigger. So we had almost 90% of all residents in Bulgaria that attended this course. it was actually a huge success because the meeting was supposed to be 2 hours or something, and it went on to be like 4 hours. And there were so many questions, and people gave really positive feedback.
That's really impressive. So this definitely was an opportunity in disguise for you guys, maybe to get more content and more time to spend together learning. And so on a better note here, I want to mention that some regions that are not usually highlighted in the ophthalmology world in general have been highlighted more with the surge of this virtual content. So maybe some regions that did not used to have the attention that they deserve are now more in the spotlight. Any thoughts on that, Anisu?
For me, what's been exciting to see is that traditionally medicine does tend to have a strict hierarchical sort of ladder where you have your professors and the guys who have reached the peak of their career, and they're almost like deities where they are untouchable and you have no access to them. So during the pandemic, as Atanas mentioned, people seem to have a lot more time. There's also been just a wave of compassion. I think going through a pandemic brings that out of us as people. So people seem to be a lot more forthcoming and generous with their information and have been exposing us to lots and lots and lots of online content. And what's been wonderful to see is that a lot of the webinars have been open access, where traditionally a lot of the top guys, the top professors would have these sort of exclusive private platforms where they share their knowledge to people who they feel are peers. I mean, even at congresses, there's certain meetings where you have only paid access or access by invitation. So it's really been nice to see some of those traditional hierarchical systems in medicine sort of being broken down, and there being open access to information through the use of technology and webinars.
Yeah, there is also the World Ophthalmology Congress that's happening, that was supposed to happen in South Africa, but now is being held virtually. I suppose this is another way to maybe put a spotlight in Africa and all the great talents that are here within the continent. Valentina, what about what's going on in Latin America? I personally come across a lot of webinar meetings that are happening there.
Yes, so before the pandemic, we had the Pan American Association of Ophthalmology. We had I would say monthly webinars. They were very interesting, but they you couldn't always attend. They were like at 6, 7 p.m. So maybe sometimes you were busy already seeing patients or maybe having something to study. But definitely now we have since each country in Latin America started to go on lockdown, like each country started to organize some webinar programs. So at first I started seeing ones from Peru, because they were the first that started like a very, very strict lockdown. So they were very interesting and I really enjoyed them. I watched them like almost daily at the start because I had more time then. But right now there are other platforms that are being developed. Specifically speaking, Ophthalmo University, it has given a lot of us boys, a lot of residents. They have this on Wednesday they have this space, like they call it empty chair. Like you send your case, you send your lecture, and if you get voted by the attendings, maybe you can present it. So they have giving us a lot of voice, and they have made some huge very interesting webinars. If you get a chance to watch them, I would really encourage you, because I really love this platform, and I really love about it that they try to give everyone a voice. It's just not like Anesu said, it's not just for from an invitation of an exclusive group of professors and an exclusive group of experts in one topic. Like you can have a voice even if you are a resident. I've seen even first-year residents presenting, and they do great. And I really love that they have the chance to get this practice, because when you do it in front of a lot of people, maybe it won't be as friendly as if you do it maybe in the coziness of your house, and maybe with a more small group of people that know that you're learning. So that has been a really, really positive impact for Latin American ophthalmology.
Yeah, clearly. And also another reason for us to learn Spanish, maybe, huh? Maybe another language in the CV wouldn't look that bad. So I also would like to mention that we saw in a recent study that was published by the American Academy talking about the situation of private practices during this pandemic situations. Can you tell us more about that, Reza, please?
Yeah, there have been some surveys going around in the country and asking about the financial situation, and unfortunately, 6% of the current ophthalmologists who are in practice, they mentioned after this pandemic is over, they are not able to open their practice. Either they're going to sell their practice or they're going to find another way to deal with that. So that's a huge number. So um, we don't have many ophthalmologists here, and it's a huge need, especially in some areas in Midwest or some um, less popular cities. Um, so it's not saturated, and it's still, if you want to see an ophthalmologist, there's a huge, there's a long waiting line. Also, some areas patients have to get their treatment by optometrists because there are not many certified ophthalmologists there. So if we look at all those needs, so it's a huge number, and we definitely need to think about the financial aspect of that, especially on small businesses. And ophthalmology is not an exception. They have to pay for the rent, they have to pay their salary, they have to pay for the insurance of their employees. So if you cannot see enough number of patients, so you have to just kind of find another solution. In many practices, they downsize their practice because traditionally they had 5 or 6 MAs and optometrists working in the practice. Now there's not many patients to be seen, so they are kind of laying off their staff and waiting to see if there's a rise in the number of clinic visits and surgery. So that's another important. We are in training and we are kind of, our salary is secured by the government, but after we finish training and it's time to find a job, so I think this is something that we need to think about. Some of our recent graduates, they just joined the private practice, and the idea was for them to make money, to be able to pay for the loan, to just take care of their family. They had some commitment. Some of them bought a house or something like that, so they have to take care of their mortgage. So these are all come to your consideration. Although we are still in training, but soon it's going to affect us. I'm positive that the academy is going to work on that and they come up with a solution that can prevent that loss of 6% of ophthalmologists, which is going to be a huge drop in the number of providers. And at the end, it's going to affect our patients because if they don't see on time, the disease can progress and we will see more blindness and vision loss.
That is totally true, Reza. This is something that we don't tend to want to learn more about as residents and trainees. We feel like it's going to come later. We're not concerned by it now, but it's very important to know how things are and to know that our home societies are taking our backs. The Moroccan society actually is also having a task force working on this right now. As you said, even in a country like Morocco, where we don't have any loans from medical school, starting a private practice really demands huge loans from people to take on to start their practices. Atanas, you also work in a private practice. How is it there? Are you experiencing anything similar?
Yeah, I can totally relate to what Reza is saying because I'm seeing the same pattern here in Bulgaria and probably all across the globe. So what I'm seeing is that small practices are really taking a hit because first of all, they have to comply with those very strict measures with disinfection, with different protocols that were enforced by the government. In addition to that, many of the patients are just scared to go to the hospital, scared to go to private practice for examination, and that really hurts them. And I've seen some senior ophthalmologists really decide to retire their own private practice. In addition to that, small practices have definitely cut some of the medical staff, including optometrists, including nurses, and including technicians. But on the other side, big hospitals and big practices are really expanding. So they have the advantage of being able to afford all those strict protection measures. They have the advantage of having a very big brand and very big inflow of patients, and they're using it to expand their practice.
Yeah, very important to share. And I would love to keep, of course, we're going to keep in touch later on to just share maybe how everyone dealt with the situation in their respective countries. I'm sure we can learn a lot from each other and from everyone, actually. We talked about how it is in training, how it is for our patients, etc. And I believe every one of us has their own idea about what they think are going to be the long-term implications of this pandemic on our discipline, which is ophthalmology. I can tell you guys that in Morocco, the first thing that comes to my mind is the waiting list for cataract patients who are already quite, take some time here in public hospitals. Those who can go to private institutes and can afford it, of course, can have a less of a waiting time. But I suppose it's going to be quite a burden for governmental hospitals. Anesu, do you have anything of mind that you think will be a long-term implication?
So my context is government hospitals, because in South Africa, as a resident, we're called registrars in South Africa. We train exclusively in state hospitals. As a registrar or resident, I don't have much exposure to the administrative aspect of healthcare. But what I do know is that a lot of our funding and money that we get from government budgets, when the annual budgets are discussed in Parliament, with ophthalmology specifically, our cataract numbers drive the funding that we get. So I am anticipating, although this might be presumptive without any hard facts, but I do know for a fact that our numbers are going to be dramatically lower at the end of this year, with us doing almost no elective surgeries for over 6 months now. And it doesn't look as if we're going to be opening up for full elective theatre slates anytime soon. So I think in general, the year of 2020 is going to be a year where statistically our numbers are going to be very low. And I'm a little bit worried and anxious to see how this is going to affect funding in the future, especially because generally, with regards to healthcare, ophthalmology does tend to be viewed a little bit lower down with regards to importance, where some people tend to consider eye care as almost a luxury thing, where it's considered almost on the same level as cosmetic surgery, forgetting that blindness has huge socio-economic effects on society as a whole. But people tend to forget that we do treat blinding conditions and focus more on refractive correction. And that is really not the bulk of what we see in state practice. So I'm anxious to see, as I said, whether or not it's going to affect our funding in the future.
Yeah, this is definitely a very interesting perspective. And thank you for sharing with us, Anesu. I had no idea the funding was discussed in the parliament, which is very interesting if people can know how things are and how they get the funding that they have to be able to maybe advocate for their patients in the future as well. What about you, Reza? What do you think the long-term implications would be?
Can you repeat your question again?
I was asking if you think there will be any long-term implications. I know that you guys started doing some telemedicine, so maybe on the bright side, long-term in ophthalmology.
Your voice is broken. So if I understand you, because your voice was not very clear, if I understand correctly, you are asking about the long-term effect of COVID-19 in the ophthalmology field. I think if we think positive, so I think now, because we are very close to our patients, especially less than 10 centimeters while we are doing eye examination, it's very good that we take care of ourselves and our patients and pay attention more to this personal health and protections that sometimes in the past we weren't paying attention to that, because they could have influenza, they could have other disease that we can catch that. So, but now COVID-19 is kind of a big thing, and we are paying attention to that. And the telemedicine and just looking at the field globally rather than locally. So during this pandemic, I end up listening and learning and watching lots of webinars at different institutes, from Ahmed in Toronto to our colleagues at Baskin Palmer in Florida, for some international lectures around the globe. So I attended many lectures. If you guys, anyone is interested, there is a global ophthalmology lectures going on every Thursday that it's led by the Stanford team, but we end up listening from our colleague from Aravind Eye Institute, Dr. Venkatash, and some colleagues from Nepal. And these are the things that we traditionally had to wait for academy to happens once a year, or go to ESCRS or international meeting in Europe to just meet our colleagues. But now we are seeing them every day and every week in our home. So we are just kind of connected. These are good things that happening. That's gonna help the future of ophthalmology, especially if you, for me, I'm interested in global ophthalmology as well. And if we are thinking about addressing all the needs nationally and internationally to help patients who are suffering from blindness, having this social media and new technology, applying this new technology in our practice is going to help a lot. So imagine that, for example, rather than arranging a trip of 10 ophthalmologists in their busy practice to go to Nepal and help the patient, they can dedicate hours in their during their weekend and just see patients through webcam, or just provide some advice to could be a technician over there that is available and can communicate with the patient, and then they can look at their visual field test, they can look at their OCT and just give them some recommendation. Obviously, some of our job has to be done in person, like surgeries, but majority of the things that we can help or the medical parts can be done via webcam if you have a good quality visual field, good quality OCT, good quality fundus photo. So all of them that can give you some opportunity to help the patient. And the other side is helping the trainees. So very few residents would be lucky to get trained by Ike Ahmed, but now more than 1,000 residents and faculties attend his webinars and learn about his surgical techniques on a weekly basis. So these are great things that's happening. If you are a fellow, if you don't have cornea fellowship in your program, you can now watch and learn from Baskin Palmer cornea team, and they're broadcasting their cornea meetings every week. So these are good things that are happening, and as a resident, I found that very useful for us.
Yes, exactly. We're really lucky. Sometimes I feel like we're having some backstage pass when you get all that content that we're really eager to just said, as you mentioned, see once a year. This is really great. And I truly hope we're going to find a way to keep that educational content availability the same way it is right now in the future. Another take that was really interesting to me is when you talked about telemedicine and how it is good to be developed in the midst of the pandemic for maybe you and people who are interested in global ophthalmology to use more in the future and reach out those patients without physically being there. This is a really great point, Reza, and thank you for bringing it up. And now, what about any clinical lessons that we can get from all this, guys? Maybe in the future, something we can do differently and make it better. Renal, do you have any idea of any things that we could be doing in our practices in a better way?
Yes, I think I'm going to bring out a very basic point, which we've all been doing and which we should really continue doing, as well as the patients should continue doing. And that is, we've all upped our level of personal hygiene and hygiene in between hygiene while, seeing patients. That is, everybody is, taking care of ensuring that the instruments are clean, ensuring that, we've used adequate amount of sterilium, we've washed our hands, and more than anything, the patients are also much more aware about how they should be taking care of, their personal hygiene and their eyes, specifically face and eyes. So that is something that is a lesson that we've learned from this pandemic, and it's something that should be carried forward. So that is definitely
an excellent point, Hina. You're so right. Something that we were all supposed to be doing very well all the time, but we were probably lazy than we are supposed to be. I'm sure that now we have all these new habits to carry on in the future, hopefully. What about you, Athanas? Do you think there are any clinical lessons that we can learn from this pandemic time?
Oh yeah, definitely. So I think a lot of people here mentioned this. We are definitely going to learn how to work with patients a little bit more remotely. So currently we are told by our mentors, never prescribe anything over the phone, never ask anything over the phone. And we're slowly moving to a new opinion of our mentors. Hey, maybe you could ask them if they really have an emergency. Maybe if they're your old glaucoma patients, maybe you can change a little bit of therapy. So this is definitely something that's going to change. Another thing that's going to change is a lot of practices are going to get optimized. So we're going to have we're going to basically become more effective. We're going to do more work with fewer resources, and this is actually a good thing. And in addition to that, I believe the education is going to be completely different. I believe that now in the next few days we'll see the biggest online congress in ophthalmology, and I bet we're going to have another one entirely online, regardless of if we have another wave or something. And this is going to continue. So online education is definitely something that's going to continue, and a lot of young ophthalmologists are going to benefit from it.
Yeah, definitely. And I would like to bring up again what Reza said earlier about people not having maybe access to certain subspecialties where they are, and they can learn a tremendous amount of the things that they would actually learn if they had it on place from that educational content that is available. What about you, Valentina? Do you think there is anything we can take out from this?
So for me, especially what I have learned, like here in Colombia, like Imane said, like Henal said, we're very close and we're very candid and we like to hug people and we like to touch each other. I think that is something that we aren't allowed now. But it's not, I'm not like saying I don't like that, because that's the way we are, and I really hope we go back there sometimes. But it has like shine a spotlight in maybe, I'm thinking like, is it maybe kind of a way to show maybe as some sort of false closeness? Because sometimes like I hug a patient, but I'm like, why did he came? He just has dry eye. But right now I'm thinking like, I can hug him, I can like show this comfort to this patient, and I like think maybe it really hurts, you know? Maybe what the patient is saying, it's just not something minor as I said. Maybe it's not just maybe it's just not something very big for me or for any ophthalmologist, but it's something that it's affecting the patient's life. So it has really made me think maybe in the things that the patients feel, maybe I'm not giving the value that it has. I have been thinking a lot of too about glaucoma patients. You know, glaucoma patients use drops every day, and I have never thought like maybe if I had to use drops every day, I wouldn't be like the best one. I'm sure of that. Maybe because I know the implications, but if I wasn't an ophthalmologist, maybe I wouldn't know this. Maybe I would think like maybe I had to use this drop that it says that it won't make me blind, but it just gives me like itching and red eye, and I don't like it. So I think maybe it has made me more aware of the patient's feelings and maybe how I can address them in different ways.
That's wonderful, Valentina. Thank you for the great reminder of how we should have empathy towards the patients, because most of the time we are completely ignorant when it comes to the way they actually feel about things that, as you said, might sound really not that big of a deal to us, but maybe a big handicap in their lives. Guys, I'm so proud of us. We are right on time. We have 1 minute to go for you guys to maybe share with other residents around the world who are going through the same issues that we are all going through in our training. I'll start with Anesu. What do you have to say for other residents?
I would like to say that keep a smile on your face. Stay optimistic. This is not the first global pandemic to hit the world. It has happened before in history, and the human race has survived it. So we'll survive it. We'll come out bigger, better, stronger. We're learning every single day, and just take it one day at a time. That's me.
I love it. Thank you, Anesu. What about you, Reza?
So I think everyone should stay positive and think about and strong. So this pandemic gives us opportunity to make new friends, to use social media to educate our patients and learn from each other more. And obviously, we all missed operating and seeing patients every day on high volume, but we're gonna get there. And just want to ask, I think everyone should stay strong and positive, and hopefully we're gonna see better days. Hopefully without Corona, but with new friends.
Yeah, for sure. Thank you, Reza. What about you, Hinal?
So,
What I want.
no, sorry.
Go ahead, Atanas.
No, please.
So what I really want to say to everybody watching this, and what I've realized at the end of this discussion, is that we all, though from different parts of the world, are literally going through the same thing, and we aren't alone in this. So, that's what we should remember. And while surgical training has been drastically affected, there are other aspects to our residency. We have this chance, which we are not going to get again, to really sharpen our clinical skills, because at the end of the day, the mind is just, the eye is just going to see what the mind knows already. So this is an excellent time for us to really sharpen our skills, to catch up on academic work, to publish, to research. And that's the silver lining that we should focus on in this dark cloud. So
Excellent point, Hinal. Thank you so much. Thank you. What about you, Atanas?
Yeah, sorry for the interruption. So I was just going to say that all of your tips are like golden, and maybe we should write them down or something, because they're so full of meaning. And I would just give the advice to basically use your time correctly. Everyone is complaining, everyone is missing out, everyone is not doing surgery. Just try to use your time this time as an advantage. See what you can do, and basically follow all of these tips that these awesome people gave you.
Thank you, Atanas. What about you, Valentina?
I would say, like, my advice would be just keep positive thinking. Maybe just think what you can do to make this time better for you. I know, like you all said, we are all with a lot of uncertainties in our residency, in our countries, in every place, in every aspect of our lives. Just make them the best of it. Try to look for people that support you. Try to look for people that inspire you. And I think that will be my advice. I have found you and a lot of people that have inspired me, and I think that has made me feel a lot better in this time. So I'm grateful for that, and just find people that support you. I would say that's my advice.
This is wonderful, guys. Thank you for the great spirit and the high note that we are ending this on. I love all your advice and all your you sharing everything with us. I am sure and I believe that sharing is caring. As Hinal said, we're all going through the same thing. It is difficult and it is hard, and it's always great to share new ways to deal with it in the best way ever. And always staying positive, because I mean, what other choice do we have, right? So thank you again for doing this. I think we're gonna go and do some questions with Phoebe now. Thank you, guys.
Hey everyone, thank you so much. That was a wonderful discussion. So like Iman said, we are about to start the Q&A part of the roundtable, and to anyone listening, feel free to submit questions as we go, and we'll try and get through as many as possible. So I'll open with one, and if anyone wants to take it, raise your hand and just go. So the first question is, are there any tools or systems that you've come across during the pandemic that you would recommend to other residents? Does anyone want to take that one?
I think I can comment on that. There are a lot of online webinars that are of huge value for our teaching. So I highly recommend people try to recognize those webinars, or you can reach out to people that you admire. If you know a very good surgeon that you have to always watch their YouTube videos, there's some background noise. So if there are a lot of, if there is a special surgeon that you admire, you can reach out to them and say that, hey, since you are holding your grand rounds or your lectures online for your residents, can I attend them? And I'm sure they're going to be open. So I think it's a great opportunity for residents. We had a live webinar about how to do small incision cataract surgery by people at Arabian Eye Institute, and more than 1,000 people attended that. Same thing with Dr. Ike Ahmed. So in the past, we have to get some time off during our residency to go to Arvin Eye Institute to learn from that technique. But now they're bringing that to you. So the residents should be very aware of all these opportunities and try to accommodate that in their curriculum. Either they can watch it as a group of residents or they can watch it individually. And most of them have been recorded. If the timing doesn't work for you, doesn't mean that you're going to miss that session. So just try to find the link for the recorded session and watch them.
Yeah, if I can add something, I particularly reconnected with my Google Calendar app, to be honest with you. This is the thing that I truly discovered during this period, because I would see webinars all over the place. I would register to every single one of them, but I made sure to always add it to my Google Calendar to have a more realistic look onto the webinars that I'm actually going to be able to assist and be able to ask questions on live, because it's a very important thing that you don't have when it's recorded. So I would say really be organized, because I'm not the most organized person, but Google Calendar or any calendar you like will be a great way. Just put everything, try to look at it and see, be realistic about the ones that you can really attend.
If I can add up to that.
Yeah, go on, Atanas.
So if I can add up to Iman's point, yeah, I've been also using Google Calendar a lot. And what I can add to this answer is that now during those times, what we had more in abundance is time. So what I used my time is to develop habits that are going to be valuable even when things pick up back up to normal. And what I've been doing is I've been trying to spend a little bit of time every day in studying for my big exam that's coming up. But actually, I've been kind of missing that when I was so busy working every day. So now I try to spend like half an hour every day, and I really put that on my Google Calendar. And if you put it in the calendar, you really have to commit. So this is a really good system, same as the webinar. So if you put it on the calendar, you have to attend. Just try to do those ifs in order to get yourself better.
Okay, wonderful. Thank you, Atanas. I'm going to go on to the next question now, and this one's for Valentina. Someone has asked, would you mind explaining the empty chair concept?
The what?
The empty chair concept.
Oh, okay, the empty chair concept, right. So this concept, it is on Wednesdays at 3 p.m. here in Colombia. Maybe you can look it up in Ophthalmo University. Ophthalmo is written like in Spanish with an F, not a PH. So maybe you have a hard time looking for it. So the thing is you send a title and a little description of your topic. It is 5 minutes. So you have 5 minutes. You have to prepare your lecture to be 5 minutes long. And they give you 2 minutes more, like maybe if you have an unfinished idea, or maybe if you have like 1 or 2 slides. But at 7 minutes, they like stop you and you can keep talking. So you send your title. It has to be a title that it's how do you say it, like very reaching to people, because the attendings of the webinar are the ones that gonna vote. If they like your topic, they're gonna vote for your title, and then you can present. So there are maybe like around 10 people that send their topics, and 4 are chosen. Of these 4, the one that gets the least votes is the one that presents first. So you go there and you present your case. At the end, there's a chair of panelists, and they tell you like, you did very well in this topic. Maybe you could be better in this one. When I got the opportunity to present a case. I really was talking like you wouldn't imagine how fast I was talking, and the feedback that I got was like, just breathe. So it's very good. Like maybe I think like backwards, and I said like maybe I would cut like maybe 2 or 3 slides, and maybe I could have spoken a little bit like more paused and better, and maybe get my idea better to the people that are listening. So it's a very good space that you can use to practice.
Sounds like a really exciting opportunity there. So hopefully people will follow up on that. I know Amanda's just put that in the chat if anyone wants a link.
I'll write it.
Okay, wonderful, thank you. Well, we've had another question through and we've touched on it slightly, but just maybe have a clearer idea from everyone. What is everyone's opinion on the first virtual conference by the World Ophthalmology Congress? And Esther, I think this one, you should take it.
Well, with me being from South Africa, I think I have an added vested interest in the World Ophthalmology Congress. First of all, I would like to say that it is so unfortunate that the world will not have an opportunity to come physically to South Africa. Our ophthalmology society, as well as our young ophthalmology society, have been excitedly anticipating this for nearly 2 years. Months and months and months of preparation has gone into this. We had put together an amazing young ophthalmology program, and we're even looking at having an outreach towards to a safari area where there was going to be cataract surgeries conducted and also game drives. So it not being physically in South Africa, I think, is a huge loss to everybody. That having been said, we are excited for the very first world or global, I should say, virtual congress of this size. I think, as Atanas mentioned, this is the biggest that the world has ever seen. Probably will not be the first. So we're looking forward to it. It's basically, we're going to be sailing uncharted seas in that it hasn't been done before. So we'll have to see how it goes. But I think that every single person who's going to be presenting is going to bring their absolute best. I hope that the fact that it is going to be virtual will increase attendance, because I know flights are expensive, getting time off work, booking accommodation. So I'm hoping every single one of the panelists here have registered for the World Ophthalmology Congress, and that everyone else watching is looking forward to it excitedly.
Again, I know it's such a shame that we don't get to go, if only for the safari. Does anyone have anything else to say?
You know, and one great thing about this conference is that all the presentations are going to be available for 3 months, even after the period of the conference is over. So I think it gives everybody good time to, you know, actually see all the presentations, which as such, when in a physical conference, it wouldn't have been possible, you know. So I think that is also something that I'm looking forward to.
No, definitely. Just to try and squeeze in a few more questions before we run out of time. Bit of feedback there. Do you think the pandemic will affect medical education? So we're not getting that feedback. For example, do you think future courses may prioritise virtual learning?
I'm sorry, Phoebe. I think we are having some echo on your. Maybe you can.
I'm able to hear.
Yeah, sure. I'm hearing that too. I'm hearing that too. It's a nightmare scenario. I'm hearing myself twice. Well, I'll try again. Would you mind all muting your microphones for a minute, just to make sure we're not getting any feedback? There we go. Okay, perfect. So one more time. This is a nightmare for you all. The third question. Do you think the pandemic will affect medical education in the future? So, for example, do you think future courses may prioritise virtual learning where they wouldn't have in the past? Does anyone have any thoughts on that?
I definitely think there is going to be a prioritization, sorry, Anisu, of virtual content because of how well adapted people are now to it. Usually before, I think everyone would double think about having something going on virtual because they would maybe suppose that not everyone is accustomed to using those platforms. But now we know for a fact that everybody is. So I suppose not only in conferences, but also medical education, you know, within departments and within universities, I suppose would have much more acceptability to having virtual content.
The point that I I did. I wanted to add on to what Imani had said, and I was going to touch on specifically exams. And here in South Africa, our final examination has a written component, a sit-down written exam, and then there's an oral component to this exam. And for the first time ever, our oral examinations are going to be on an online platform where it's 2 days of oral exams. The first day, we're going to have videos of ocular motility defects and pictures of fundus photographs and have to answer questions on that. And then the second day, where you would normally have an interview with a face-to-face panel of specialists and professors, this is going to be held over an online conferencing platform. So it's really going to be interesting to see how that is going to pan out. And I feel like a bit of a guinea pig because I'm one of the candidates that's going to be or that's going to have to sit through this first ever online-based exam.
Yeah, my seniors here also who are appearing for their who are done with their theory paper, part of the exam, and are appearing for their practical exam are facing a similar situation where they have to now switch to an online mode of the exam. And they are also feeling like guinea pigs, pretty much like what you guys are facing there.
So I would like to speak on this topic. I have a brother that's on medicine school because you were speaking like, medicine education, not only ophthalmology. So I think a downside is that patient relationship can be built in a platform like this. It can't be replaced. Not only speaking surgically, but just learning how to ask the patient what he feels, what he thinks, what he hurts. I don't know. Maybe just I think that can't be replaced, or maybe I'm just obsolete. I don't know, but I think that can't be replaced. And I think we need that training. We need patient on face-to-face training to learn medicine. And it's just not like for ophthalmology, it's for all fields of medicine. I think a very important part, and I don't think we will replace even in like internal medicine, that maybe you don't do like surgery on the patient and you don't need like all these fancy things that we use in ophthalmology. Maybe I don't think it will be replaced. I think maybe when we go back, we will go back with a lot of new things, a lot of feedback of how to do it properly, but I don't think it will be replaced, not even in medicine school.
Tanas?
If I can add up to that, I totally agree with Valentina. She actually mentioned a very key point. You could be the best medical student, you could ace all your exams, you could have straight A's, and then you can be a very lousy doctor. So being a doctor actually requires talking to patients, understanding them, feeling what they feel, basically learning empathy cannot be taught entirely online. You have to be with the patient, you have to see a lot of patients. And on that, I totally agree. But what this time gave us is the opportunity to explore the theoretical teaching and theoretical examinations. So a lot of universities here in Bulgaria actually adopted online examinations. So first they were kind of reluctant, oh, the students are going to cheat. But then they developed systems in order to monitor them, to control them. And now they have basically most of their exams online. Some of them are tests, some of them are theoretical, and some of them are even oral. So this is a big step for medical education, I believe.
No, definitely. And our next question sort of bounces off that slightly, and I'm not sure if you've got any thoughts on this. Someone has asked, many ophthalmology residencies reserve intraocular surgery for the final year of residency. Has the pandemic made an argument for practicing surgery earlier?
I can
Matt,
add.
do you want to take that? Oh.
Go ahead, Reza.
Thank you. Yeah, it's very unfortunate. So especially people who are affected women, there's not much time left for them to catch up. The class that just graduated or will be graduated in 8 days, they lost a huge volume. But thankfully, it was just in United States. It was just the last 3-4 months. So hopefully, they get enough exposure and training at the beginning of their final year. But moving forward, if the situation remains the same for people who are going to be in training next year, people might consider doing extra year of training as a fellowship or something like that, or even after graduation, they might just hang out with their mentors and operate under supervision for a while till they feel comfortable in going in private practice and starting operating their own. Because at the end, it's for the safety of the patient and also safety of the surgeon to do the best thing that the patient deserve. So no one wants to jump into doing surgery individually while they're not well prepared.
Iman, did you have something to add?
Yeah, I can't say something specific about the timing, because I know from a lot of colleagues around the world, the surgical training varies tremendously in terms of timing and volume, etc. But one thing that I really want to emphasize is that if this is anything, it is an opportunity for us to include much more simulation in our surgical training. I mean, doing any simulation training wouldn't have been affected by a pandemic or anything if you have it somewhere that everybody can access in a safe way. So this is what I really want to emphasize on, is probably this is maybe a time for us to think more about investing in simulation for trainings, I believe.
Could I ask what you use for your current simulation training? Anything in particular?
I do not particularly right now but when I was doing a fellowship abroad a couple of years ago, I used the IC simulator. I used to spend weekends working on it. I loved it.
No, it sounds excellent. This was a bit more of a negative question, depending on how you see it, but do you worry about your own job prospects? Iman?
I'll go again because I finished my, in terms of time, finished my residency training in March. And, you know, I had so many different plans of pursuing further training or maybe starting to work and waiting for that further training in a form of fellowship or else to start. But now all the timings are messed up. We have not taken our board exams just yet, and we do not know the date. So maybe in that aspect, in the timing aspect, I am a little bit worried about maybe missing out on certain opportunities that I was counting on.
I think on that topic, like I'm a year ahead from my graduation, but I'm really worried about my fellowship. Here in Latin America, we are very mean to make a fellowship programs. So right now, people that started maybe 2-3 months ago, some fellowships are like very worried about this topic. And even people that are maybe ahead on their fellowship programs, because the fellowship program here in Latin America is the time when you get your surgical skills like on point. So if you don't have any time hands-on patients, you can do this. So it is something that's very worrying me, because I don't know a year from now where will we be. I don't know if maybe we will still be in this pandemic or if things will go back to normal a year from now. So that is my main worry right now.
Well, we have time for one more question, and it is quite literally a positive one. And we mentioned this before, but it's probably more of a practical tip. So how do you stay positive in the face of adversity? What are your own personal tips for maintaining a positive mindset?
One thing that most of our residency programs they started was kind of wellness program. They provided online wellness programs, and that's a good habit that we continue. Like you can practice yoga online, or there are some programs that you can do step by step to just deal with the stress and also whatever happening globally. So I think that's something that I value much, and hopefully I can practice that in the future, because mindfulness is something that we need to always pay attention and also take care of ourselves to be able to provide good care for our patients.
For me,
Yeah, I
personally,
feel
you can go first now.
Okay, so I feel like one of the reasons that the stress really plays on you is because our routine is disrupted, our daily schedule is disrupted. It's a different new normal. So I feel one thing that really helps is still maintaining a schedule for yourselves and really sticking to it, allotting time for various things that you have to get done and sticking to that. And second is just try and try and still take the opportunity, take whatever opportunity is available. That is, if we aren't getting a hands-on surgical training, we still go, we still try to observe, we still actively assist and increase our observation skills as well. So those are the things that make you positive at the end of the day. So that's something that I feel is important.
Sorry for chipping in there, Hanal. For me personally, faith is a big thing. My faith is what has helped me stay positive. Over and above faith, though, I think perspective is key. It's so easy to become very short-sighted in our view of things. And as I mentioned before, we're going to be ophthalmologists for the rest of our lives. All of us on this panel are residents, young ophthalmologists. None of us is well into our 40s yet, I'm assuming. If we are into our 40s, we all look fantastic. So we're all still young, relatively. And in the grander scheme of things, losing 12 months of intensive surgical or clinical training, I doubt that it's going to have as big effect as what it sometimes feels like when you're in the moment and you're focusing on all the negatives. So as I said, perspective is key. And then I love what Atanas has said. He's repeatedly emphasized taking away the positives from this season. And one of the positives is time. I mean, I'm sure all of us can attest to being so overwhelmed with clinical duties that you don't have time to read and to enjoy ophthalmology. So time is a big thing that we have, something that we didn't have in as much abundance previously. And then access to new ways of learning. So again, that comes back to perspective, where if you focus too much on the old norm, you can get so caught up being negative about the fact that I don't have clinical exposure, but you have something else. So focus on that and let that shape your perspective. Let that be, not to use eye-related puns too much, but let that be the lens that you view the world through right now. So that's it from me.
Can I say something? So I love your take on S1 faith. Just have faith in whatever you have faith, but have faith. And I think a practical tip from me would be write down all the positive things that you think you can get from this time. And it applies to everything, like write it down. Take a paper, take a pencil, and start writing. Being positive isn't something that comes natural for all of us. Maybe you have to take time thinking what it is really positive about this time being for you, for your life, for your residency, for your family, for your your time. Just take the time to think hardly what is really positive and write it down and read it every day, and maybe add every day one more positive thing that you saw that day. I think that would be my advice on that.
So I just wanted to actually squeeze in a little shout out, because I think the various societies in my country, including the Young Ophthalmologist Society of India, has really tried to kind of, especially for the residents, has tried to organize grand discussions, case discussions, and kind of try to contribute to our learning and probably keep us positive in that sense. So I really do want to like squeeze in a shout out here.
Oh, your mic, Atanas.
So very quick comment in the end. I would like to add that all of us that are here, I know all the panelists and maybe all of the people that are watching, we're all type A personalities. We want to improve ourselves. We want to get better every day. And the fact that we're missing out on learning, that bugs us. We are not in our world. We cannot travel right now. We cannot meet people. And this really is shaking us. But in the long run, if you follow those tips, if you stay positive, things will come to you. You'll get better. And eventually, with that positive mindset, things will be great.
I just want to emphasize quickly on the sharing is caring, and I really believe this helps me tremendously. The fact that I am sharing with residents all around the world through social media, it has been a blessing, honestly, to be able to have such a connection in an easy, quick, and efficient way, and be able to share such things like we've been doing in this session today. This really helps me keep in positive.
I'm really glad to hear it. Well, it pains me to say, but we've run out of time. So I just want to thank you all so much for joining in the discussion. And it's been massively rewarding for me, and I'm sure it has been for our listeners as well. So just a bit of admin. This webinar will be available on demand in the next couple of days if anyone wants to revisit the topics that we've covered. And yeah, so that's all we have time for. So thank you all so much for your insight, and thank you everyone for attending. It's been absolutely lovely. So take care of yourselves, and hopefully we'll do this again soon. Okay, bye everyone.
Bye.
Thank you. Bye.
Thank you.
Bye.
Ooh.